Hi, Ms. Martin. Here is my video on my explanation for exercise prescription. I do have some notes written here on the computer just to make sure that I address everything that you're looking for. I'm going to talk to you, the computer, as if I'm talking directly to a patient right after they told me what their concerns are. So here goes. You understand there are some specific tasks we need to work on, such as getting out of bed, walking, and getting up and down out of a chair without as much help or being more independent. But your main concern is doing these tasks without getting too short of breath or being too tired. Is that right? These tasks may be broken down into parts during the treatment session to ensure your understanding and the capability of what you can do. You can improve these pieces, or as you improve these pieces, we can piece them back together as a whole task. Let me explain to you the concept of how we're going to improve your endurance while doing the tasks broken down and as a whole. First, we want to practice the tasks while focusing on how long we practice, how many times we're going to practice it, maybe use some weights depending on your capabilities, how many times a day we will practice it, and then the level of intensity we will practice this. This is considered your exercise prescription. We can alter these if you need to by checking your heart rate, your blood pressure, and your O2 stats to ensure we are challenging your heart and lungs without overexerting and being safe. For example, to practice walking, we're going to check your vitals and get a baseline. While you're walking, I can monitor your stats. If your heart rate is maintained by a medication such as a beta blocker, we will use the Borg scale to ensure your safety. The Borg scale measures your level of exertion during the activity. The beta blockers directly impact your heart rate, but not necessarily your blood pressure or your respiratory rate. If I see your blood pressure and respiratory rate rise, that's a good thing. This means you're challenging the capability of your endurance levels. However, during the exercise, if your blood pressure or your respiratory rate become too high, we will stop, we'll rest, and we'll keep monitoring your vitals. We want to see them come back down to a safe limit. Every treatment session will try to challenge you a little bit more. This will increase your endurance levels, and you won't feel so tired while walking. Other things I'll look for while during the activity are signs of exhaustion, such as cyanosis, which is when your skin will have a little shade of a blue to it because your O2 has dropped. You may be sweating a little bit more than normal. You could have a loss of balance. You could have a hard time breathing or a shortness of breath. Keep in mind, we need your body to reach the target heart rate, which is the heart rate necessary to improve your endurance during function. This is 50 to 80% of your maximum heart rate. We will find your maximum heart rate by subtracting your age from 220. During the activity, if your heart rate goes above 80%, you may not receive the endurance increasing benefits, or you may become fatigued and exhausted too quickly. After the treatment, we want your vitals to come back down to the baseline, or at least close to it. You may feel tired or a little out of breath. Tomorrow you may even be a little sore, and that's okay. Your breath will come back, you will have more energy later on, and your muscles will be sore because you work them out. The sore will go away. For the rest of the tasks you want to complete, such as getting out of bed and getting up and down out of your chair, we will work in a similar fashion. We will practice these tasks specifically to improve them.